Greenway family. I am here with one of our beautiful patients, Miss Katie, who is how many weeks pregnant now?
34.
34 weeks, and she has been with us since before this little girl was even conceived.
Yes. Mm-hmm.
Yep. So just tell us a little bit about what originally brought you to our office. How did you hear about us?
Okay. So actually, I first heard about you guys from my boss that comes here, and she knew that my husband and I were having some issues trying to conceive and seeking some fertility treatment. And she saw a posting that Dr. Barnes posted about just how aligning the spine and things like that can help with fertility, and she told me about it. So I called him and got an appointment set up, and from there on out just learned more.
Yeah.
And found
Don't
out
worry, guys. Obviously, this is a happy ending of the story.
And I knew that I had a very I guess crooked or curved, I should say, lower spine. So I learned more about that and how it also affected my, not just possibly ability to get pregnant, but even just my digestive system and all sorts of other things.
Exactly. And obviously we haven't done x-rays anytime in the past 9 months, but before, whenever we did take re-x-rays, because I think we got up to your 3 months at least, you had almost a 10 degrees correction on that curve. So that's just a true testament to how structure truly does affect function, not just with the reproductive system, but also the digestive system, your kidneys, everything that those nerves in that lower back are going to, just with that curve, how they were pinched. But now, since she is pregnant and her stomach has gotten larger, we've been doing a different technique called Webster on her. So just tell us a little bit about how your adjustments have changed from in the beginning and to now.
Okay. So in the beginning, I guess the focus was more on my spine and neck, because I didn't have the curve in my neck either. And just adjusting that, which made a really big difference too, I could tell in my digestive health. And just a lot of things, even just pain that I used to have in my lower back, all went away. And then after getting pregnant, like you said, it was more of the Webster, which was really, it's really helpful with, I guess, just opening up my hips.
Exactly.
I've heard a lot of women talk about round ligament pain and things like that. I have hardly had any of that. And I think a lot of that is due to the adjustments.
Yep, so with the Webster technique, it's something that's super specific, and we just want to make sure that the pelvis is perfectly aligned so that the mom goes through the pregnancy without any pain, but also so that the baby can have as much room as it needs to grow and develop, and then towards the end, get into that perfect position for birth. So a lot of people kind of think of it as like the baby flipping technique, but it's not. It does so much more than that, and it's so helpful for not only the growth of the baby, but just the health of the mom throughout this whole process, because obviously growing a human inside of you is not the easiest thing, and she's still working. She's awesome. So we just want to do everything that we can to just make the process as easy as possible. Awesome. Well, is there anything else that you want to say? There was one more thing that I wanted to say too. I know this was a question that someone had asked me earlier, is do the tables like move? How do we, get them into the position where we can do the adjustments? And what we do is we actually have a pelvic piece that lifts up, and then we have a pregnancy pillow so that the chest and the stomach is all very comfortable while we're doing the work on the low back. And there's never any thrusting or anything throughout the midsection, so it's very safe, very gentle, and obviously very effective.
Yeah, it doesn't hurt at all.
Yeah.
It actually feels better.
Yeah, every time. And we'll be looking for a picture update in about 5 weeks.
Yes.
With hopefully this little bundle of joy. So we are so excited to meet her. I know we've been talking to her and just everything throughout this process. So thank you again for being on video for this, and we'll talk to all y'all later.